Hi, I'm Joe Ruzick, physical therapist with Synergy Physical Therapy and Wellness. And if you've had neck fusion surgery or other neck surgeries and you're struggling with what to do because you're still in pain, I want to let you know that this is not unusual. The fact is, just because you take pressure off the nerves physically, kind of the structural side of it, I'm sure you were told, hey, you have a pinched nerve, maybe there's spurs or there's collapsing of the vertebrae, now that's fixed. Great. But you many times, in fact more often than not, will still have pain for many reasons. The muscles in the area are typically very tight, there's spasm. This is normal because you've been in pain for a long time. You've been in chronic pain. All these muscles just get tight. They kind of lock up. Your shoulders will even start hunching up. Sitting, trying to read or do computer work or work at a desk many times is still very painful. So people get very frustrated. They say, why did I do this surgery if I'm still having this much pain? I met with someone recently who that was their scenario. I mean, she was just very, very upset that why did I do this if I'm still in this much pain? Now, many times it will help the pain in the arm initially if you were having arm pain with it, but you'll have a lot of pain up here, or sometimes the arm pain will still be there, and we have to realize that, that nerve has been pinched for a long time and it's going to take time to recover. So what we do is look for other causes and other factors of, why you're still in pain. Again, it could be as direct as that nerve has been pinched for a long time, so it's going to take time to heal. We have methods to actually address that part of it. Another bigger picture part of this that is really largely ignored by the typical medical system, typical PTs as well, pain management, is when you are in chronic pain, that is completely different than a fresh injury. This is a totally different mechanism. It's a totally different situation. Your nervous system has become locked into having that pain for a long time, and it doesn't just go away typically just with something that happens in a couple hours like a surgery. So there are ways to address that. They are not widely known, but they do work. Is one of our specialties here. We also have a lot of other methods. So the key really to what we do with somebody like you, if you're struggling with that, or a loved one, is we need to figure out what's going to work the best for that individual, what's going to get the quickest pain relief for them so they can start feeling better. Then we can get into, let's do movement, for instance. Okay, neck pain. Almost always you're going to have a very tight upper back as well. So if your upper back doesn't want to move, your neck is going to kind of be getting too much stress, too much motion. It's going to be asked to do too much, if you will. So we really have to restore that motion of the parts of the neck and the upper back and even the lower back. Okay, the spine is just a chain reaction. It all works together. So we have to capitalize on all that, because especially with a fusion, if you had a fusion 2 or 3 levels especially, well, your neck now has lost motion. That motion has to come from somewhere. You're still going to want to turn over, look over your shoulder to check your blind spot when you're driving. So we have to make sure that that motion in the other segments of the spine is still occurring optimally, so we don't overuse the part right below the fusion and lead to pain and lead to degeneration in that segment. So yeah, it's just a couple examples of how we would help someone in this situation. So if you or a loved one are struggling with that, you've had fusion, you've had neck surgery, you're still in pain, you don't really feel like you're getting the right answers, and sometimes even the person just feels like nobody even cares. They're like, well, I don't know, you shouldn't be in pain, so just give it time, give it up to a year. I would say that's bad advice. I think we need to try everything we can to help people in that scenario and get rid of that pain as quick as possible. So feel free to reach out. I'd be happy. This is one of my kind of passionate things is people that are just suffering without needing to, but just because they don't know about this, they don't know about the solution. So feel free to call me. I do a free telephone consult to anybody who reaches out and mentions this video, 719-568-9790. Or if you really want to just come in and get started, call and ask for an initial consultation. Just get started on therapy. We're going to get right into pain relief day one. We're gonna work on some things to help you immediately, with the goal being get you back to where you want to be, which is just having no pain. I mean, that's where we all need to be. So hope this helped, and I hope I get to meet you in person. Thanks.